Enter the room.
Hello, I'm Dr. Khalil. I'm one of the junior doctors working in the GP surgery today. Am I speaking to Mr. Rupert Pemble?
Yeah, doctor.
Yeah, and what can I call you today?
You can call me you can call me Rupert.
All right, and could you confirm your age for me, please?
Yes, doctor, I'm 24.
All right, thank you. So, Mr. Rupert, I understand you've been having trouble completing your work. Is that correct?
Yeah, doctor.
Yeah, so can we talk more about it if that's okay with you?
Yeah, doctor, that's why I'm here.
Yeah, so do you mind telling me what's been going on?
I don't know. I just don't know how to talk about it, but I just feel anxious all the time. I don't know what to do, like to just overcome this thing that I'm going through.
Mm-hmm. Don't worry, Mr. Rupert. We're here to help you today. We see patients and people dealing with such things all the time. I would like to ask you a couple of questions so I can support you better. How does that sound?
That's okay.
Yeah, so you told me you feel anxious while completing your work. So what is it that you feel like you're not doing the work correctly, or you struggle to complete
Um,
it?
Yeah, this habit that's been like with me for the past few months, like 4 months. Since then, I've been like, whenever I touch anything, I touch table or any like anything like that. So I just feel that I've got infection. I have to wash my hands. Initially, it was just like 2 to 3 times, but now it's like after every 10 minutes, every 20 minutes, and I'm just sick of it, doctor.
Mm, I can see that you're distressed, and we're here to help you today. I can see that you're a medical student, so I just want to ask if this, was happening 4 months ago as well.
Yeah, it just started 4 months ago.
Okay, okay, all right. And do you see yourself, having thoughts that you can't really control? You want to get rid of them, maybe?
Yeah, I try to, but it seem help. I just think I'm helpless with that. I just need
Mm-hmm.
to like do certain actions to control them.
I'm so sorry, you're going through this. Do you have to do something to get rid of those thoughts?
Yeah,
So what do you do?
I wash my hands. I keep on checking the doors all the time.
Okay, okay. And do you have to, go back and clean your hands a certain amount of times to feel okay?
Yeah, I just told you, doctor. I go like 20 to 30 times a day, and
Okay.
my exams are coming up
Yeah, I can
next month.
understand. I can see this has been impacting your, work as well. So how is that going for you? Are you able to work at all?
It's difficult to work around the patient with these kind of thoughts, and it's difficult to like study as well. How will I pass my exams?
Mm-hmm. And do you have any trouble sleeping?
No.
Okay. And how has your appetite been? Are you able to eat?
Yeah,
Hmm. And how has your mood been? Do you feel low?
I'm not sure about that, doctor.
Okay. And do you enjoy the activities that you used to enjoy in the past?
Yeah, I still love painting, reading. Yeah.
Mm-hmm. And just to check, you mentioned checking the door knobs. Do you have to check the oven knobs as well, or wash your hands at home as well?
Sorry?
Do you have to check the oven knobs as well at certain times? Do you feel like you haven't closed the oven?
No, it's
Okay.
just the doorknobs, like before going to sleep, at least 10 to 20 times maybe.
Okay, all right. And have you taken something for it or have you spoken to anybody for it?
No.
Okay, all right. So thank you for opening up to me. I can understand it has been impacting your work and you seem worried. I just want to ask a sensitive question, and I'm so sorry to ask this, but have you had any thoughts of harming yourself, maybe?
No, it's not like that.
Okay. And just to check, 4 months ago, did something happen? Did you have an incident or anything that triggered these episodes?
I think one of my uncle got diagnosed with hepatitis C, maybe. Yeah. something
Okay.
like that.
Okay. And do you have a family history of any mental health conditions?
No,
Okay. And just to check, do you take any medicines on a regular basis?
no,
And do you have any allergies?
no.
Okay. And I just want to know if you understand what is going on.
I don't know.
Okay, don't worry, we're here to help you and support you in the best possible way. Do you have any other concerns for me today?
I just want to get better. Initially, I just thought that I was taking care of my hygiene, but now it's just a bit a toll on my mental health all the time.
Mhm.
So I just want to get better.
Yeah, I can see that, you're distressed. We're here to help you. Is there anything that you're expecting from us today in particular?
No, I just want to get better.
Yeah, and just to check,
2 minutes remaining.
yeah, I'll be taking a look at your vitals as well to see if everything's going fine. I'll be checking
Yeah,
your blood pressure, your heart rate,
vitals normal.
the oxygen levels in your blood, and your breathing rate, if that's okay.
Mm-hmm.
Okay. So all right. So from what you've told me and from my observations, it seems like you could possibly have something that is called obsessive compulsive disorder. Have you heard of this before?
Yeah, I've read it, but I'm not sure
Mhm.
about the explanation.
Yeah, so I'll walk you through it. Obsessive compulsive disorder is basically, it comprises of two things. So there are obsessions, the thoughts that you can't control. These are repetitive thoughts that come into your mind. And then there are compulsions, the acts that you have to do to control these thoughts. So, what we're going to do for you today is that. I'll be referring you to the talking therapy. So we'll be doing some talking therapy for it, which is EMDR, which is based around this. And then, the psychiatrist will walk you through it. Will be referring you. Is how does that sound?
Oh, that's good.
Yeah, and if that doesn't help, we can start you on medications, which is sertraline, which is an antidepressant. So if the talking therapy doesn't help, it only then we we recommend taking the medication. I can also give you some leaflets to read about it, but at any time you feel overwhelmed and you feel like you cannot control your thoughts, you can always ring back to us.
Okay.
Yeah. So the first step would be speaking to a specialist. And if that doesn't help, we can start you on medication. So they will do something to help you control.
Move on to the next station.
All right, good job, guys. Thank you so much, Dr. Hafsa, for that simulation, and good job, Dr. Maham. All right, right off the bat, I wanted to bring out some points. So, what is EMDR?
Eye
Eye
sensitization.
movement,
Eye movement sensitization.
Yes, all right, but
Reprocess.
and reverse.
But
why
I think, isn't this for PTSD?
it is
I
absolutely is.
absolutely forgot.
But also the fact that you're talking like you're talking to another, definitely medical student, but you definitely have to make it a like a lay person. Like what
Mhm.
will she understand from this? Right. I mean, what will he technically understand from EMDR? Like what does that entail? Like what is the whole point of just mentioning it like that? Right.
I knew I knew it isn't for OCD, so then I didn't talk about it anymore.
One thing. So don't mention it in the first place.
Yeah.
Definitely that is wrong. So what is it that what exactly do we use in this place?
It
It's called exposure
it's
response.
ERP. Yeah, it's ERP, exposure response prevention. Yeah.
Try not to use abbreviations. That's what I'm trying to highlight.
Mm-hmm. Mm-hmm.
Right. Because, you're abbreviating after knowing something, right? That just shows that, you might not even know what the full thing is. You
Yeah.
probably say the full thing and then abbreviate it, right?
Yeah.
Because it's just letters and it doesn't really mean much because you're trying to be non-technical here, as
Yeah.
non-technical as positive or possible. right? So you want to get across to the patient, not show that you have all this knowledge. I mean, that's exactly why they came to you in the first place. Right?
Yeah.
That's nothing trying to show off. What you're trying to do is you're trying to get through to them in order to use your by using your knowledge and helping them out. Right? So that
Mhm.
should be the aim. Right? So if you know something, explain it and mention what it's called, because you're giving it the name and you're giving it an idea of what it is. Or else just leave it at CBT, right?
Mhm.
Because if you go ahead that extra step, if you're not even sure, don't mention it,
Mhm. Okay.
right?
Yeah.
Because necessarily you might get a mark reduced for even saying the wrong thing or not, or using the technical words.
Yeah.
Yes, Dr. Vigdan, you have a question, go ahead.
Hello. No, I don't have a question. I just wanted to say that for exposure and response prevention, she can also say in simple words that we will expose you to the similar thing, and without acting on the compulsion, like you have to we will help you in that. Like in simple words, we have it helps you to face the feared situation without acting upon it.
Absolutely. That's good. That's a good explanation for that as well. You can actually provide the explanation. In fact, that should be one of the questions in data gathering itself. The question should be, what happens if you don't wash your hands? Have you ever tried
Yes,
that?
this is what I was about to say. That she can add this question as a question as well. That if somebody shows you anything which, like the thoughts are coming in your mind, that must be something like which you can't avoid. But are you able to avoid it or not?
Mhm. Absolutely. Exactly. And that's exactly what you're trying to understand from this patient. What is the extent of this compulsion that you have? I understand that there are these intrusive thoughts, they are compulsive, but what happens if you don't act upon it? Because that's technically your therapy. That is exactly what you're advising. And that's also something that she can use in her day-to-day practice, right? So not only the fact that you're bringing this to her understanding that this is what she's suffering from, giving it a name, but you're telling her small strategies that she can implement, right? So that is very important. So that's great. That's great. Thank you, sir, Dr. Vigdan, for bringing that up as well. So a couple of other things that I wanted to mention in this case. So you guys completely changed the case, first of all. The hepatitis C and everything was not there in this particular case. So that is something that I want to highlight for you guys. The cases might be something that you are, familiar with. It might also be something that you're not familiar with, right? Go in with a grain of salt. So don't. So what is the major concern? So I made this case in such a way that she has been having this. I'm sorry, he has been having this, but of late it's been increasing. What does that mean? That this patient just didn't start having it from sentinel event. I didn't bring that sentinel event point, but then I brought in that factor of trigger, meaning you need to identify triggers. you know so why has this been happening of late? Are you under some stress? That's the question you need to ask, right? In the Canada information, I don't think I added the big the hepatitis C and all of that, right? So
Yeah,
intrusive,
I'm
there's
so
no
sorry to cut
Uh,
you off.
yeah,
I did ask her if she was, experiencing this 4 months ago as well. But
but,
she,
but
yeah,
why 4 months?
because she
Why?
mentioned that it started 4 months ago.
Oh, is that?
Yeah.
I think I added that information at all there. Yeah, so I just said, it's just happening off late, right? So, yeah, so good. If she's mentioned the 4 months, definitely use that. Use the words that the patient has used. Don't bring in aspects that are not, mentioned by the patient themselves. Right now, also, you're trying to look for that sentinel event. So you're trying to understand, is it something that has just started, or is it something that she's been happening? If this is something that has been happening, is it has been increasing? What is the reason for its increase? You're looking for the trigger. So you understand, you're not forcing that situation. You're not forcing into a situation. Right. It can come with a lot of variations, and you guys need to be prepared. Don't force it into any variations. Another way that I actually understood this, I mean, I wanted to highlight about this, is that you asked about, a specific question. Do you keep looking at the pan or specifically you started asking for some certain symptoms, right? So the whole idea of OCD is that they have a thought process that keeps repeating and being intrusive in their mind. In this case, the anxiety, the good question to ask about, Dr. Vedan, I'll just give you a moment. Let me just finish this thought that I'm having. So I'm so sorry that I was mentioning. So the anxiety that you're trying to understand is what is the thought process that she is having? It's specific to her, right? And if there are other such thoughts that have been repetitive and intrusive in her. So you are trying to understand what are the different thoughts that she's been having so that you can elicit that this is repetitive compulsive thoughts. I mean, obsessive thoughts. And then what is the action she takes for the thoughts, right? Is the compulsion you're trying to bring out. So you're trying to understand where all is she having it? Is it just focused only in the wards? Has she had it anywhere else in your home? Have you been having such repetitive thoughts? What do you have repetitions for? Is there any specific things or at any specific time that you have these thoughts? You're trying to bring it out in her words, rather than putting it in her mouth, putting the words in her mouth. Do you understand what I'm trying to say? Otherwise, it comes out as rehearsed. Do you understand?
Yeah,
Yeah.
definitely. Yeah.
You're trying to bring it out. You're not trying to force it. Right? So you're trying to understand what is the extent of it. So you understood there was an incident in the ward. Now you're trying to understand, is there any incident at homes like that? Is there any incident otherwise in the social gathering? Do you have such incidents when do you have such repetitive thoughts? What are the thoughts like? In all these settings, is she under a certain pressure? You're looking for triggers, right? What happens if she doesn't give in to those triggers? You're trying to look at the extent to which this disease is affecting her, right? So then you can bring in so then you can explain it holistically. Like I have understood that from your conversation that you've been having this usually in the wards, or you've been having it usually when you're at home, so that you can bring it tailor it according to her needs or her case specifically. And now you mentioned that it's been happening a little often. You also mentioned that your exams have been coming. So are you under a lot of stress for it? So you can bring in the factor that, this tends to exacerbate when you're under stress, right? And, because of your upcoming exam, it seems to be that you are a little bit under stress. And I can help you with that. Do you understand? So you are understanding the extent and you're offering support, right? So that way it doesn't look like it's tailored. I mean, it doesn't look like it is rehearsed. Yeah.
Yeah,
I
definitely. Yeah.
Really awesome. So great job. And a couple of other things. So you need to understand what is her basic concern, what made her, because he has been suffering from this for a while, it looks like. So why did he come to the hospital all of a sudden? Like, what is it that he needs out of you? What is the question you'll ask for it? Nice. Definitely. You need to understand what are your expectations? How do you expect, what are the helps you expect from me? What is the kind of help that you're expecting from me? Right. So he might have answered something like, I'm having my university exams and I'm really worried that work is not getting done, studies are also not getting done, and I'm not sure how I can cope with it. So you can offer that extra help. Since he has a diagnosis, you can actually talk to the university on his behalf. You can put in your words, right? You can actually write a medical note so that certain provisions can be made. Do you understand? So those are the kind of help. So understanding how it's the extent to which it's affecting him, you can offer that additional help needed. So this is the whole point of that holistic care that I'm trying to highlight here. Just that he is affected by this. His work is getting incomplete. Like, what other expectations does he have from from this consultation? So understanding that, you can actually offer the needed help. All right, awesome. So let's quickly take a look at the performance. But good job, Dr. Maha. I think you did a great job. Just the part where I feel that don't use rehearsed questions. There are certain questions I feel you're asking because you probably might have read it elsewhere. You know, what you're trying to do is you're trying to elicit the symptoms. You're trying to bring out what is affecting them. You're not trying to, you're not asking them leading questions. You know, this is called leading questions. Like, do you look at the stove when it's heating? What if that person doesn't even cook? Like, no, I don't cook.
Yeah.
Then he'll be thrown off. He'll be like, oh, damn, I don't have any other symptoms to ask. I'm so sorry, Dr. Vigdan. Yes, please go ahead.
This is what I was about to say, that she was asking about the stove. Might be she don't cook. Why she's asking about the stove? So it was it looks like everything is scripted here, you know. That's why she shouldn't ask about the stove.
Absolutely, absolutely. Thank you for supplementing that. Absolutely, because what you're trying to bring out is not specific symptoms. You're trying to bring out, how the symptoms are, present in this patient, right? Because you might have encountered it in another patient. That can happen in your clinical practice as well. You probably might have encountered this kind of a case in another patient and you saw that this was the compulsion, but that might not be the same compulsion in the next patient that you encounter with OCD, right? So you need to understand what is specific to them, right? So you understand the disease, which is exactly, being the GP or the doctor that is having this consultation. That's the knowledge you have. Now, how is that disease affecting this patient is what you're trying to find out. Hey, you're playing Sherlock Holmes here. All right. So thank you so much, guys, for your involvement. That was an interesting discussion we had. So let's quickly look at the checklist. All right, confirm the patient's full name and age. And so you brought that fact that he was in a medical school, and you can use that to your advantage in kind of building a little bit of a rapport. Like, I can see from my notes that you are in a medical school. How is it going? How are you handling things? You can start off like that, with a friendly gesture, right? Especially since you're also a doctor and you've kind of been through the process. So you can start questioning like that. Right, even though it's not really a fully consultation, but you're looking for opportunities to build rapport, right? So definitely use any information that you can where you can actually start, the conversation like small talk. Awesome. So begin with open question. Can you tell me about what's happening and what makes it, what's been happening that makes it hard for you to complete work? Yeah. Explore contamination fears. For in this case, this patient, the intrusive thought is contamination fear. The intrusive thought, the repetitive thought that is coming is contamination. That is specific for this guy, right? And that is in a ward setting. But in another setting, what is the intrusive thought you want to figure out? You need to understand that, right? So what is the thought for which there is an action? Do you understand? So you're trying to bring out that thought. Yeah. So contamination fear and anxiety around seeing patients, that's a specific trigger. That is a quantified compulsion where there is hand washing, checking frequency, and total time. So quantifying helps to understand, if there has been an increase in that habit or that behavior, right? So you can understand that of late, this has been happening more often. So you can understand that there could be a potential stressor or another trigger that could be causing. So you can actually look for that trigger, right? So usually, how many times do you do this of late? How has it been, has it been increasing or not? So that you're looking for those specific triggers. Yeah. Inquire about repetitive checking behavior and what is the trigger and what triggers. Screen for depression and anxiety symptoms, low mood, anhedonia, irritability, restlessness. Good job there. Assess for suicidal risk harms, and definitely that's important because every time, even if you have a symptom, you want to rule out the red flags, or the worst conditions that can happen. Yes, Dr. Hafsa, you have a question.
Yeah, when she asked me about the suicidal symptoms like the self-harm, so she was so direct. She didn't even signpost it. So I just wanted to mention this.
Yeah, that's a good point that you brought up. Thank you so much, Dr. Hafsa. And that's actually good because this is something that is kind of unusual from your usual round of questioning. Right. So this patient is come with like an anxiety and you're asking, do you, have you had thoughts of killing yourself? So that sounds little off even for the patient. So, you want to signpost a little before actually asking something that drastic of a question, right? So even if you're going or if you're going to be venturing into some uncomfortable territory, try to signpost. And the whole idea of signposting is just telling them that, okay, so I'm going to ask you something uncomfortable, but this is not to make you uncomfortable. It's just for me to understand the extent of this disease. Right. So in that, I'm saying that colloquially, but you can always mention, like, just signpost a little, because that again brings in rapport. Because if you throw your patients off, by asking such uncomfortable question, they may not answer you correctly. They may try to hide those aspects. Right. So you want them to be as free as possible. And you want to tell them the purpose of the question is not for judgment, is just for me to understand the extent so that I can offer you the, the full potential of my help. Yeah. So definitely signpost there. This is very important, right? Sexual history, suicidal risks. These are important areas that or even drug abuse history and all. That's when you want to signpost. Signpost is also good, especially when you're changing from one domain to another. Like if you're changing from asking for symptoms to even asking for social, how it's impacting them socially, right? So you can always say that I'd like to know a little bit about how this is impacting your life, so that I can offer you the resources that that might be available to help you. Right, just by saying that itself, they'll be more comfortable in answering your questions, so that they are also looking for help, right? So yes, that's a good point that you brought in. Thank you so much. Take relevant history, past psychiatric history, medical history, any current medications, substance that you have been having often. Is there any use, substance abuse, caffeine, family history of any psychiatric illness? Is this something that runs in the family? So you're looking for any risk factors that might be there, any potential triggers. Yeah. Ask about mood, sleep, appetite, and screen for associated anxiety or depression. Yeah, you've done that before as well, so good job. And then finally, you want to do a couple of general physical examination, record vitals, just for a baseline test, because you just want to rule out any other things that could be causing anxiety, probably like hypothyroidism or something like that, right? So just quickly rule that out as well. And then partially covered, assess functional impairment across studies, social life, sleep, and concentration, right? So you did look into the ward, but how is it in other settings? You want to understand a little bit more about that. Screen for intrusive thoughts, degree of control, like degree of control that you have over your thoughts. That's something also you want to understand, right? Do you get repetitive thoughts that you try to resist but can't ignore? That's something. Or another way of asking is that when you do get these thoughts, have you tried not giving into them? What happens if you don't? That's a simple way of asking that as well. Yeah, awesome. So now let's look at the management. So first point, these are the points that are covered. That is, explain the working diagnosis, where you're telling them that this, introducing the disease name, disease by its name of obsessive compulsive disorder, what it means. You did mention that very well, the obsession and the compulsion part. That was very well done. And, see, this is good because initially you introduce the word and then you explain what it is. So I'm very clear. But then when you spoke about, the management, you just gave me an abbreviation. And I'm like, yeah, sure. I'll do that. Right. So whenever you're bringing in something, always try to explain it, just by giving abbreviation. I could say, yeah, I just go ahead and do ABCD. I'm like, yeah, I'll be doing ABCD. Right. So always follow it up with a layman explanation, so that, they also have an idea of what you're talking about. Right. So SSRIs, yes. So usually you give non-medical management and then you go on to medical management, right? So that is something that you can explain. First we will try this, and if it doesn't work, we can supplement it with a couple of medications as well, right? So this is actually, it's seen that this usually happens because of overstimulation of the brain as well. So that's why you're trying to give something to dampen that, like SSRIs. Yeah. And if you're mentioning SSRIs, always mention, how long it takes for them to act, because usually the effects don't kick in immediately. So yes, partially covered, reassure, educate about OCD is a common in high pressure setting and it's treatable. he's feeling very anxious about the fact that he's not able to complete his work, and this is something that you want to normalize for him, especially something especially when there are more stressors like exams and all. You want to like make him a little more comfortable about that, be like, or this usually is seen in people who are working in high stress environment like ours, and you want to bring a bit of a rapport there, and normalize it, tell them, talk about the prevalence of it, the high prevalence of it especially, yeah, and talk about how treatable also it is, right? And then after that you can go on to the different strategies that you can use for treating them, right? Offer first line referral to CBT with exposure and response prevention via talking therapies. Set one graded, that is exposure response prevention style goal collaboration, right? So you can also tell them to implement that in their day-to-day practice, like example, delay hand wash probably by 1 or 2 minutes. See how you can deal with that, right? That is also something that you can tell them to do. Emphasize reducing compulsions gradually and not suddenly to avoid heightened anxiety. Advise lifestyle support, that is improvement in sleep, hygiene, regular exercise, structured routine, reduce caffeine and other stimulants. Yeah. Recommend trusted self-help resources like OCD UK, Mind, NHS, and self-guided CBD programs. Give relevant patient leaflets and resources on OCD and mental health support. Offer university support with consent. Provide medical notes and signpost to students' well-being for adjustments. Yeah. Safety netting and follow-up. Arrange review in 4 to 6 weeks earlier if worsens. Urgent help via GP 111 or A&E if he feels overwhelmed or at risk. Yeah. So what is the risk you're actually, trying to safety net for? Any self-harm or any other heightened anxiety or depressive situation that is preventing him from being more, functional. Interpersonal skills, acknowledge and validate the patient's concern, use empathy, non-judgmental language, validate the stress and efforts so far, right? So everything you want to keep encouraging the patient for taking this step to coming and talking to me. That's a great step you've taken, and you want to keep encouraging them so that they follow through with their treatment plan. Normalize and destigmatize, explain false danger signs, like sometimes the patient might go like, I think I'm going crazy or something like that. So if you hear they have such heightened responses, normalize the situation a little bit for them, right, so that they feel a little more comfortable. Confirm confidentiality and ask consent before sharing with university or resources. I think I accidentally put this here. So, understanding that he has some sort of an anxiety for his exams, you can actually offer some help. And actually, since he has a diagnosis, you can give in additional help to help with certain adjustments or considerations that can be given for him, since he is, he seems to be actually having a relevant medical condition. Offer reassurances and support throughout the consultation, maintain a patient-centric approach, and respect the patient's concerns. I actually marked you missed for this, especially because you're not looking for the patient's, issues. You're making issues that could be something that the patient could suffer from. That's like a shot in the dark. If you put in a symptom and if the patient doesn't have it, then just a loss of a question and time, right? So you want to be a little more open-ended when it comes to that, rather than actually using leading questions. Share decision, offer options, respect preferences for therapy versus combined treatment, right? So after you actually mention all the treatments that can be used, you can ask him, what would you like to try? How do you like, what plan, are you okay with the plan? Yeah. So that was Psychiatry. Thank you so much, Dr. Maha. That was a great performance, I have to say. And, a couple of pointers that you can use to improve that, the way you conduct that consultation. I think your data gathering was pretty good, but it was a little extensive and a little repetitive at times. So, you can understand, what are the important questions to ask, not to ask any leading questions, and then get to management fast. Hey, that's one thing that has been, a common issue with a lot of people, and that is something that we can all work on. That is something that you need to try working on, especially when you have 4 marks allocated for management. No matter how much data gathering questions you ask, you will not get those marks for management, right? So try to get a management as soon as possible, guys. Definitely.
Yeah,
Awesome. Yes.
yeah, Dr. Ann, I actually have a question. You mentioned something about signposting when I'm asking the suicide risk. How do I do that in a better way?
All right, thank you so much for that question. That's a good question, definitely. So it's going to be intrusive, so you can mention it along the lines of I'm going to be asking you a sensitive question. This is important for me to understand the extent to which this issue is affecting you. Yeah. Have you had any thoughts of self-harm or suicidal thoughts? Yeah, that's one way of actually questioning them. Yes, Dr. Hafsa, you have a question.
No, I don't really have a question. I just wanted to answer this question that Dr. Maha asked. So usually, many people use like these two approaches. Usually, we can say like, "I'm sorry to ask this question, but it's really important." So apart from this, are you facing any thoughts of any dark thoughts or any thoughts of harming yourself or other? Or some people they do it like this with this third person technique. Okay, so when people go through these sort of situations, so they thought of harming, sometimes they think of harming themselves or the other. So has this ever been the case with you? So you can just do it like third, as a third person approach.
Absolutely, that's a good one, Dr. Hafsa. Definitely, that's also one way of asking that question, and there are different variations. And Dr. Hafsa has also brought in a lot of good variations to that. Yeah, absolutely. Yeah, adopt one style, and try to use that. Maybe you can adopt different styles in different consultation, but whatever comes to you first. But think about signposting when you're going into sensitive territories for sure. Awesome. Thank you so much, guys. That was great. All right, so that was Dr. Maha, who just did a psychiatry case.